Okay. So we are thrilled to have all of you leaders here today to stand up the first meeting of the Building Bright Futures Child Outcomes Accountability Team. And this group is going to be co-facilitated by Building Bright Futures and Help Me Grow Vermont. So you'll hear quite a bit from myself, from Beth Trzanski, from Lauren Smith, and other members of the Help Me Grow team as we move through the group. And we're going to start by talking a little bit about the team's charge, everyone's connection within this system. We're going to frame in the context of Vermont's Early Childhood Action Plan and talk a little bit about the role of this group and how it's coming about. Next slide, please. So we want to start by level setting that we are all working towards the same vision, which is to realize the promise of each and every Vermont child, ensuring that the early childhood system is integrated, continuous, comprehensive, high quality, and that it's an equitable system of services that's accessible and will actually improve outcomes for all children in the prenatal period to age 8 in their families. And that's an important distinction. I think that sometimes we talk about early childhood as birth to age 5, sometimes age 6. When we are talking about early childhood with this team, we're talking about the prenatal period to age 8 and their families. And what's exciting about this group is we have an incredible opportunity for so many reasons right now. One is that we had this incredible update to Vermont's Early Childhood Action Plan, which we are really excited to share with you and get folks involved in that vision and this strategic plan. But in addition to the VCAP, we also are experiencing this COVID-19 pandemic and this broader recommitment in the state of Vermont to dispelling systemic injustice and racism. And so when we're thinking about our work and what we're doing right now on the ground, we have so many different opportunities that we've been kind of catapulted towards because of those three things. And so it's really important for this group to be on the same page to think about how we break down silos and how we do our work more efficiently and collaboratively. So before we frame the work of the committee, I want to just quickly walk you through a visual. So next slide, please. That's articulating the role of Building Bright Futures in the context of Act 104. So Vermont's Act 104 is Building Bright Futures statutory charge, which is framing a little bit about our work on Vermont's Early Childhood Action Plan. So for those of you who haven't seen this new visual for how we've been talking about our work, what you're seeing on the left side of the screen is that children and families are at the center of everything that we're doing. So on the y-axis, you're seeing children and families. And on the bottom, you're seeing evidence and data to inform the rest of the system. So Building Bright Futures has reaffirmed our commitment to being evidence-based. We are using evidence and data to make decisions at every layer of this broader network infrastructure. At the very base, we have 12 regional councils and so many partners across different early childhood contexts that are trying to understand the gaps and respond to those gaps through developing strategies at the regional level, and then bringing those regional best practices and innovations up the layers of our infrastructure. So the regional councils are really bringing folks together on the ground to identify and respond to gaps and fill those needs for kids and families. Our VCAP committees are the infrastructure by which we are monitoring Vermont's Early Childhood Action Plan. So regional councils identify needs and priorities and elevate them, whereas VCAP committees have a specific topic area or charge that they are monitoring to support the system of services. And those two groups are informing Vermont's Early Childhood State Advisory Council. And for those of you who aren't on that council, that's the group that is really the group charged with advising the governor and the legislature on the current status of kids and families. So that group identifies priorities annually and makes formal recommendations. They do that by taking all of these other layers of the infrastructure to inform their work. The Early Childhood Interagency Coordinating Team in that blue bar is the public partners, so our state agency partners that are on the State Advisory Council. And that group is charged with coordinating all of the other components and layers of the infrastructure. That group comes together and says, okay, we know the barriers and challenges and priorities. How do we make sure our leadership understands them? And how do we align and integrate? And then all of those things are informing policymakers and decision-making. So gaps, barriers, and challenges are escalated up. And as policies and decisions and priority guidance are happening at the highest level, we have an infrastructure across the state to be implementing. Next slide, please. So what you saw in that last slide is that Building Bright Futures as an organization is charged with having this network infrastructure. It's around 300 people involved in different layers of that, whereas our team itself is only around 12 people that is supporting that infrastructure. And one of our key charges underneath that is to hold the strategic plan for early childhood for the state of Vermont. So this year, through the Preschool Development Grant, we had an opportunity to update Vermont's Early Childhood Action Plan. This is our new visual and the framework for this plan, which we are thrilled about. So this is not going to be a new visual for any of you. We're using the ecological systems theory and this systems framework to say we're really focused on children at the center of everything. And the child at the center aligns with goal 1, which is all children have a healthy start. This is the full charge, or at least the majority of the charge of this accountability team, is to monitor goal 1 of Vermont's Early Childhood Action Plan. And I'll talk you through these different layers just so you have a sense of what else to expect in this action plan and how your work informs the rest of this entire infrastructure. So goal 1 is all children have a healthy start. At the next layer, it's about families and communities, right? So goal 2 of the action plan is families and communities play a leading role in children's well-being. So in that families bucket, we're talking about improving and strengthening families and building family resilience and community resilience. The next layer of the infrastructure is the community, and that's aligned with goal 3, which is all children and families have access to high quality opportunities that meet their needs. So not surprisingly, everything that we're talking about in goal 1, how do we provide a healthy start, is also going to appear in that community level where we're actually monitoring the system of services as well. And so that system is, we're talking about health, nutrition, childcare, education, and libraries, you name it, the infrastructure of the communities and the different resources that we need to have to support families. And then at the highest level, it's the system. And that's aligned with goal 4, which is that the early childhood system will be an integrated, well-resourced, and data-informed system. And so again, I would argue that this group, this child outcomes accountability team, is one of the most important because you're setting the tone for what we do in the rest of the system, which is why we were trying to bring together a really strong group of leaders across every sector that touches kids and families. Okay. Next slide, please. So as we're thinking about goal 1, one of the things that we are focused on is that children are healthy, thriving, and developmentally on track in the prenatal period through grade 3 by promoting and monitoring outcomes in the following domains. So physical health, development, educational outcomes, mental health, basic needs. And it's also promoting the importance of prevention and early identification across domains. And so what we're really excited about in this goal is that we actually in this year have an accountability infrastructure. And we know from what we've heard from all of you in every single meeting, accountability is one of the most challenging values to articulate in this collective action and collective impact model. So the question becomes, who's responsible for what, when, and how? And that's really challenging to define in this state system. So as we're thinking about the role of Building Bright Futures, it's not that BBF or even this committee are charged with collecting data, but it's about using evidence and data to inform the system of services and providing that mechanism to support accountability. Okay. And so when you're hearing about the work of this committee, what I hope you're thinking is, okay, we're not talking about any one system or one service or one data point. We are recognizing that everyone on this call is an expert in their area. It could be in nutrition, health, any of the things that I just mentioned above, childcare, education, mental health. But we're bringing this team together because your voice is critical to actually improving outcomes and developing the strategies that meet families' needs. And so because of that expertise, we want this team to serve as the monitor that's monitoring these outcomes on an annual basis. And so if you can stop the screen share for just 1 second before we talk about indicators, I want to be able to see everyone's face. Okay. How many of you have been working to improve early childhood systems or your sector for 5 years or more? How many of you have been in early childhood? Okay, every single person on the call, which also tells me that you're all deeply committed to your area, to the work of improving the lives of kids and families. And so what we want this group to do is bring your expertise to this table and to be able to help support alignment in some of this work. So one example of one of the challenging things and the challenging topics that this group may dive into is that so many of us are committed to developmental screening, early identification, not just for kids who may be at risk for delay, right? Children who may be at risk for developmental disabilities, but also for those who may be at risk for social contributors or determinants of health. And what is the follow through? For once a child's identified, how do we get them into services? How do we make sure that they are supported in a comprehensive way? I think a lot of folks on this call are also really passionate and recognize the importance of screening for all of those things across every single sector. And that may be, early education, pre-K, K-3, health. There are so many different sectors that we're operating and doing our work. And we recognize that high quality early experiences, early childhood education, all of these things serve as protective factors. And we know the importance of early identification and screening on child's long-term outcomes. So Beth, if you want to go back to the screen share, I want to quickly just show you, what do we know about some of our indicators today? What do we know right now about some of our outcomes for kids and families? And this is not a comprehensive view. This is just a quick snapshot. So in our perinatal health world, we know that almost all women had at least one prenatal visit and 92% of women had a postpartum visit. In child health, one example of an indicator is that 89% of children under 6 saw a healthcare provider at least once during the last year. In mental health, we know that 1 in 5 children between the ages of 6 and 8 has a social, emotional, or behavioral health condition. When we think about developmental outcomes, 63% of Vermont's children have had a developmental screening in the first 3 years of life. In education, one example of an indicator is that of children assessed, 50% are proficient in reading. And for students who are eligible for free or reduced lunch, that proficiency drops to 32%. In the area of basic needs, in the 2019 to 2020 school year, there was 373 children under the age of 9 who were enrolled in schools who met the definition of homeless based on the McKinney-Vento definition. So that's just to give you a snapshot of some of the data we want this group to be reviewing. And that's Vermont specific. We also want to be talking about national data and national best practices and bringing that into the conversation as well. Okay, next slide, please. So in terms of our overall charge for this group, it's to improve integration and coordination of early childhood public and private partners who are committed to the health and well-being of children and families. It's very broad. It's intentionally broad because we want a range of leaders across sectors at this table. So what we're asking this group to do is use that commitment, use your expertise, and bring it to the table so that we actually have really solid outcome data, research on national best practices, and that this group is examining gaps and where are our opportunities for alignment. It also involves this group really leaning in and saying, okay, we're going to be brave. We're going to have challenging conversations. We're going to lean into discomfort and we're going to break down our silos. We're going to build alignment in our vision, in our language, how we talk about our work, the strategies and programs to really truly build a seamless, equitable system of care for kids and families. And I think all of you know, and this to me is what I love about coming back to Vermont, that the key component to success for this team is collaboration and open lines of communication. It's the relationships. Again, we're all passionate about this work. We all are really engaged in our one component of how we support kids and families. And in some cases, we're operating in our silos. I think one thing that's really important to name for this group and just put it out into the world is that we know we're operating in a period of scarcity when we think about our resources. So a part of what we are asking this group to do is very clearly involve clarifying our roles and responsibilities. So within our domain, these are our roles, these are our responsibilities, and where do we have alignment across sectors? Where are we duplicating efforts? And how can we support each other in building our narratives and leveraging those resources that we have that are scarce? And take a step back from feeling like we're competing against each other for resources, because that's kind of where we are in the system right now. So I want to do another quick raise of hands. If you can stop the screen share. So virtual show of hands. How many of you in your sector would say that you are doing early identification, developmental monitoring of delays in social contributors of health? Raise of hands. Everybody. And that's awesome, right? We're excited about that. We want everybody to be doing this work, and we want you to be talking to each other and knowing how folks are doing that. Who's using what tools? Can we standardize some of this work so that folks are doing the same thing and really supporting one another's efforts, right? Another show of hands. How many of you connect families to resources and services? Everybody. How many of you are promoting family resilience? Everybody, right? We're all doing the same work. And now this team is our opportunity to do that work collectively together. And that's what's really exciting for me. And I hope that you're seeing that, again, Building Bright Futures role is not to be doing these things that you're all raising your hands for. We're not the people doing direct service. Our job is to bring together all of these experts to help align and help support this continuous integrated system. So what you're also seeing in this raise of hands exercise is there's a lot of overlap in what we're doing likely on the ground to support kids and families. And we want kids to have access and families to have access no matter where they're entering the system. And that's critical. But our opportunity is to learn more about how each of us are doing this work. So what does it look like in childcare settings? What does it look like in the health department? What does it look like in schools? And how can we bring together, clearly delineate our roles, but then support each other to reduce duplication? This group will also, again, really be focused on monitoring data. So again, we are not collecting the data. We are leaning on the experts who are collecting data and bringing it to this table to use that to build connection and really support this narrative that we in Vermont are using data and evidence to inform policy. And the final charge, and then I will stop talking at you all, is that we were provided with a grant by AUCD, the Association of University Centers on Disability, and the CDC, to co-lead the effort of aligning our work in early identification and building family resilience. So we are partnering, and part of the reason we are partnering so closely with Help Me Grow leadership and BDH is we are co-leading that grant. And so we're really excited about using this group to also monitor the work of that grant. And you'll hear a bit about that in a couple of minutes. So before we kick off introductions, I want to introduce our co-facilitator, Lauren Smith from BDH, to provide a little bit more feedback and introduction.
Thank you. It's so lovely to be here and see all these friendly faces. Morgan, that was a beautiful introduction. And I think the only thing that I would add is that, all of you know that COVID has amplified and intensified the previous gaps and needs that we know have existed in our state. And that, with that, there has been also opportunities that have been, brought forth because of the pandemic. And I think this grant opportunity is one small example of that. And I think this larger team and being able to leverage this leadership team is another perfect example. And I think, what we know about the reality of the work, the hard work that we've all been invested in for so long, that we just saw that visual of with your raising of your hands, is that there has never been enough for all families and all children in Vermont, or I would argue anywhere. There's never been enough resources. And so now we know that that has been even intensified amidst this pandemic. And so it can be really hard, I think, to shift from that scarcity mindset. But I think, we have this group of really, what I'll use Morgan's term, kick-ass leaders, right? That we have to, it's a call to action to shift from that scarcity mindset, and to really be thinking about, where are there places where we can be thinking about disruptive innovation? Where can we be nimble and flexible? Where are there opportunities that maybe we've been chewing on for a while, but we don't have time to chew on anymore? I think telehealth is a perfect example. I mean, we thought about implementing telehealth to improve, healthcare visits and to be more accessible for a long time. And lo and behold, COVID hit, and here we are on screens, right, for everything. So I guess that's, one point that I just wanted to kind of, elevate even further, is that we have called you all here and named you all as leaders in this work. And that, knowing that this is a really difficult time, and that the gut reaction can sometimes be to hold your cards really close to your chest in that scarcity mindset. But what we really need to be doing instead of reacting is responding and thinking about, how do we all come together? How do we build efficiencies? How do we share what we know, and coordinate and communicate for the best outcomes for our children and families, and thus our communities and our systems, right? And that's what's going to make this sustainable beyond COVID. And just to end on a really bright spot, for those of you that have heard me talk before, you know that I say this all the time: Vermont is amazing. We are really national leaders in this area of work, in thinking about resiliency, and the resiliency project that Auburn is leading. Having a CIS state team is such an asset for our state. Having Help Me Grow, who has been here on the scene for several years and who was able to do a rapid COVID response, and now be thinking about, how do we sustain these changes in terms of early identification and developmental promotion across sectors as a shared priority for every adult who comes into contact with young children in our state. So we really have a lot to be proud of, and a lot of momentum, I think, to build on. And we have a great opportunity to keep moving that work forward with all of you through this team. I think that's
Thank
all.
you, Lauren.
Yeah.
That's fantastic. So I'm going to transition to have Beth lead us through our reflection question to do introductions. I also want to quickly say that I know Danielle has had to jump off the call. We are thrilled to have her as our CIS and early intervention leader on this call. So I'm really excited to have her, and I hope that we'll be able to have meeting times where folks are able to attend, and they won't all be this much of talking at you. It will be more integrated, we promise. And we recognize that Amy needs to hop off as well. So Beth, if you want to get us started on introductions.
So it's great to have us around our virtual table, and would love to do somewhat of introductions and reflection on this team's charge, which is to improve integration and coordination of early childhood public and private partners committed to the health and well-being of children and their families. And I'll put that in the chat bar. But would love for you to share your name and your affiliation, and one way, we know there's many, but one way you contribute to the team's charge. So Amy, if you could share before you hop off, and then maybe we'll go to Becca and Cheryl and Pam, and I'll cue folks up in the chat bar. Just so I know we don't have time for all the things that we do, which many of us cross paths regularly, but just one thing.
Okay, I'll lead it off. I'm Amy Johnson. I'm the director of the Parent Child Center at Northwestern Counseling and Support Services. I'm also the co-chair of the Vermont Parent Child Center Network. I think one thing that I bring is that I'm able to look at the system, or I'm not forced to, but I do look at the system through many different lenses, as the network leader, as a PCC, and as a designated mental health agency. So just having those different perspectives, and being in a region that is is doing a lot of really great collective impact work to have innovation and problem solving strategies around the system of care.
Thanks, Amy.
And Amy is also a member of the State Advisory Council representing PCC Network.
Yes, thanks. And I have to go. It was great
Thanks,
seeing
Amy.
everybody.
Take care.
So I'm Becca Webb. I am the regional coordinator for Act 166 for 10 supervisor unions, kind of in the middle to lower half of the state. And I was really thinking about this prompt, and I see myself as sitting kind of in this corner of the relationship between public pre-K and the implementation of Act 166, but also like the publicly housed pre-K programs and the child cares. And so how do we kind of coordinate and support each other in this work?
Great. Thanks, Becca.
I think you called me next, did you not, Beth?
I don't remember. Go ahead, Pam.
Okay.
Please.
Anyway, I'm Pam McCarthy. I'm president and CEO of Vermont Family Network. And, our work is around supporting families of kids with special needs with a real focus on children with special health needs and disabilities. But I've been involved in this systems work for years and years and years here in Vermont. I have over 30 years experience in systems and family work, and a real heartfelt commitment to integration, collaboration, and coordination. I'm very excited to see this array of people coming together at a time when we really know the gaps and the priorities more than we ever have, given COVID and the forced change that we've been through and some of the opportunities that exist. So I'm here as somebody with a lot of history and a current focus around kids with disabilities and special health needs. However, I came to the work as early childhood way back when. That's where I strongly am rooted and continue to be, and have been in the past a parent-child center director. I was in Amy's job way back when, very connected to the network still, and also was an Agency of Human Services field director up in Franklin and Grand Isle. So again, my appreciation for integration is, again, foundational to the work that I do, and I'm excited at this opportunity. So I hope I can bring something and take something back to my own organization and work. Thanks.
Thanks, Pam.
I think I was next.
Go ahead, Cheryl.
Hi, everyone. Cheryl Wilcox from the Department of Mental Health. So nice to see so many faces of favorite people that I love working with. So I'm the Interagency Planning Director at VMH and also currently the Interim Policy Director. And my hope is that I bring connections to our different departments. It's the role that I sit in doing interagency work, is to make sure that we're connected across AHS, and it's something I love and have been committed to for years. And just have to say, Brina, I'm so happy to see your face, and I miss you so much at AHS. I haven't seen you in a long time, sorry. So I'm very happy to be here, and am glad to have been invited. Thank you.
Thank you. Brina, do you want to go next, and then maybe Charlotte and Jen after her? Oh, but you have to unmute, Brina. There you go.
There we go. Okay. I have to call in on my phone with technology issues. I was just saying thank you, Cheryl, for saying that. I miss seeing all of you so much. Just a quick update, September 8th, I became the physician advisor to the Maternal and Child Health Division. Elisa Stahlberg is now leading the division as the director, and I'm also working as senior faculty at the Vermont Child Health Improvement Program. So not a great time for a transition, but such is life. But I really intend to stay quite connected to this work. I hope to bring to this group the pediatric healthcare delivery arm and the data. Those of you that know me, I'm completely obsessed with measurement and data. So, and it's fun to think that that's kind of the cornerstone of this work, because I think those of you that have been around a long time know that we've struggled with measurement, and it's just so fun that we're not even debating that anymore. So here we are. I guess the last thing I'll say is just that great reminder that we have the best pediatric healthcare in the country. We cover kids in our Medicaid program to 312% federal poverty, and 99, I just saw the data from 2019, 99% of Vermont's children have a medical home and health insurance. So that doesn't mean that we don't have a ton of work to do, and we've learned a lot about deductibles in this world, that having insurance is not always a sure access, but I did want us to be grounded in that principle, because I think the pediatric medical home needs to be much more utilized, as you know, for connection to kids and families, because they're all there.
Great.
Thanks.
Oh, awesome. Karina, send me that data for How Vermont's Young Children.
Yeah. Charlotte and Jen, I don't know if you guys are queued up and willing to share one thing.
Yeah, oh, are you?
Yeah, we can see you. Go ahead.
Okay, so I'm the co-chair of the BBF Families and Communities Committee, one of the parent co-chairs, and I am a stay-at-home mom. So I just bring parents and families to the table and bring what we talk about here back to the Families and Communities Committee.
Great. Thanks, Jen, for being on with us. Charlotte?
Hey, good morning, everybody. Thanks so much for having me. My name is Charlotte Safran. I am a consultant with the Division of Maternal and Child Health, working on really making sure that our family engagement, family partnership systems are consistent and sustainable. And I also hold that role with the University of Vermont Children's Hospital. So I'm really here with a family partnership, family engagement lens, and excited about the opportunities to sort of utilize some of the language in the Early Childhood Action Plan to make family engagement sort of be consistent across sectors. So thanks so much for having me.
Awesome. Thanks for being on. Auburn?
Yeah, hi everybody. I'm Auburn Watersong. I'm the Director of Trauma Prevention and Resilience Development at the Agency of Human Services. I'm in the Secretary's office. My position was formed by Act 204, which was passed in 2018. And it basically charges me with working across systems to help find opportunity and opportunities for coordination and opportunities for improvement of outcomes around trauma prevention, the mitigation of toxic stress in families, resilience development across the state. And I'll just throw out there our new statewide definition of resilience, which is the capacity to thrive individually and collectively in the face of adversity. And so I will bring this lens to this conversation around how do we develop resilient children, but also the resilient communities that will support them. So I'm really looking forward to this work together. Thanks a lot.
Thanks, Auburn. That's great. Kate Rogers, I wonder if you want to go next, and then Elizabeth, and then Bev.
Oh, sure. Just so you know, there's a garbage truck out my window.
Of course, good timing.
So, hi, everyone. Thank you for inviting me onto this group. My name is Kate Rogers, and I work at the Agency of Education. I'm the Early Education Programs Team Coordinator there. We oversee Universal Pre-K Act 166 with public and private pre-K programs, as well as early childhood special ed services that children receive. We work with Agency Human Services. We work with Daniel House, the Part C coordinator that supports infants and toddlers. We work hand in hand with them. And we are feverishly have been promoting early multi-tier systems of support scale up across the state. And it's important to share this because early MTSS is evidence-based, research-based practices that absolutely address children's and families' needs. And we could put practices in place with the systems surrounding it to work with children who have been affected by trauma and all kinds of concerns. So just want to put a plug in for that. The preschool development grant is working with that at the moment. And so pay attention to early MTSS and scale up and sustainability across the state. So thanks.
That's great. Janet Kilburn, are you on? Do you want to share briefly? She's on the phone. Okay, Bev, do you want to go next and we'll let Janet get off mute?
Sure. Hi, I'm Beverly Boguette, and I work with Let's Grow Kids. And when I look at the collective talent of the people around this room and the years of experience, I feel still like the new kid, even though I've been at Let's Grow Kids for 2 years. It's going to take a while before I'm not the new kid anymore. Most of you know Let's Grow Kids and our mission and focus on high quality, affordable childcare, being accessible for all families in the state of Vermont. And along with Tanya, who is also on this call, we've been working a lot around, we're kind of charged with the intersection and integration of early childhood education and healthcare. And so I'm so excited to be part of this conversation and part of this group and try and bring the early childhood education lens to this conversation.
Thanks, Bev. Janet, do we have you? Can you share briefly?
You have me. Can you see me? I'm outside the oral surgeon's office waiting for my daughter to wake up. So this is so fabulous. I'm so excited to see all these wonderful people here and hear what people are sharing. I'm just so excited about the potential for collaboration and all of our work together. And I've been doing work for a long time as the CDC Act Early Ambassador, and also then aligning that with work with Help Me Grow. And I think one thing we're really excited about right now is how forward-thinking Vermont is in using developmental monitoring and screening as a proxy measure for social determinants or social influencers, social conditions, trying to use a strength-based term, but social conditions of health, and how we know that adversity, hardship affects kids' development, affects family well-being, and certainly social emotional development, and really using our screening tools, our new online platform to support getting kids extra help and families extra support and resources before those delays even show up. So, as a preventative upstream measure. So great to be here. Thank you all.
Thanks, Janet. Cynthia, will you go next, and then maybe Dora and Amy?
Sure. Hi, everyone. I'm Cynthia Green, and I'm here representing Shelburne Farms and Vermont Feed, although for most of you, I kick around as the teach manager with the Vermont Association for the Education of Young Children as well. And I am super excited. For those of you who know, I've been involved with this group in many iterations for many, many years. And I think one of the things I'm very excited about is right now I'm working within the food systems, nutrition, food security realm. And so really thinking about those basic needs, concrete supports, and it's all through farm to early childhood. I shouldn't say all, it's broader than that, but my particular lens is through farm to early childhood, which right now is really focusing, frankly, on equity and quality childcare, and food security and food nutrition, with family and community engagement, sort of through that early childhood lens. So for me, I feel like this is a real cool intersection of that opportunity for screening, early identification, but then to Bev and Tanya's components about really linking with early childhood settings, and how to support some of those concrete needs. So glad to be here.
I'm Dora Levinson. I am soon to be the Data and Policy Director at BBF. I have had a split role with a regional coordinator hat down in Southeast Vermont, so Brattleboro AHS. And my background is in monitoring and evaluation and program improvement. And so I am super excited to literally have outcomes in the name of this group, and to be able to help support the monitoring so that we can all be aligning, but also making sure that we're being effective and efficient with our limited resources. So I am so excited that we are all meeting and to see the faces around this the screen, as well as sorry about the echo, as well as the people who aren't on this call at the moment, but who are definitely involved in this work. So happy to be here, really excited about the potential.
Thanks, Dora.
Hi, everyone. Amy Bolger here. I work with the Child Development Division as one of 2 early childhood and after school systems specialists. The unit that I work in is called the Systems Building and Community Collaborations Unit. And one of the myriad ways that we who work in that unit and throughout CDD are focusing on improving integration and coordination is that I'm so happy to bring my public health and quality improvement background to this work. We look a lot at what lives at that intersection of quality in early childhood, accountability, early childhood systems, and data. Those of you who were maybe on the STAM plenaries, listening into those STAM plenaries yesterday. This is an increasing focus in the world of quality rating and improvement systems. And so anyway, that's one of the lenses that I'll bring, and I'll be really happy to be charged with anything you'd like me to bring back to my colleagues in my unit who focus on PD and other pieces of the puzzle. Thank you for having me.
Awesome. Thanks, Amy. We're going to have Elizabeth, Tanya, and Renee next.
Hello. So I'm Elizabeth Gilman. I'm the program manager for Help Me Grow. And I think one of the things that is kind of unique in the situation that I'm in with Help Me Grow is not only do I get the opportunity to really look at some of that systems work and work directly with medical providers and early childhood educators and other community supports for families, but I also get to work with the families as well. So I get the privilege of wearing 2 hats. So this is a really kind of exciting opportunity to have this grant in place where I can kind of see what's happening systematically and data-wise, because we do collect a lot of data at Help Me Grow, as some of you know. But then I also get to speak with families and see how those systems are working for them and actually do those social contributors of health screens with them and really talk to them about navigating those systems that are so difficult for families sometimes to get through. So I think it's an exciting opportunity, and I think it's something that really offers my role and my coworker Mike's role to really kind of play 2 parts in it. So it's pretty exciting.
It is. Thanks, Elizabeth.
Hi, everyone. I'm Tanya. I work at Let's Grow Kids. I'm a community and program support specialist. So a big part of my role is being a champion for early childhood educators. And I have the privilege with, one of the things I get to do is partnering with Help Me Grow and VCHIP and, all of our great partners at Vermont Department of Health. And we're working on some of the pilot programs that are going to guide some of this work in developmental screening and early childhood programs.
Thanks, Tanya. Renee?
Good morning, everyone. Can you hear me okay?
Yeah.
Okay. So my name is Renee Kelly. I'm the director of the Vermont Head Start Collaboration Office. Also just want to echo what everyone has already said. Very exciting work. Very happy to be here with all of you great brains in the room. I think, in terms of what the Collab Office can bring, this team really resonates with the function of the Collab Office itself. So the charge of the Child Outcomes Accountability Team being improving integration and coordination, that's pretty much what the Collab Office is all about. It's really about improving integration and coordination between the federal Head Start system, which is federal to community, and the state system itself. And I think, all of Head Start and Early Head Start, those are programs really geared for the most vulnerable folks. Whether it's folks living below the poverty level, children experiencing homelessness, foster children, kids involved in the child welfare system. So this work is very near and dear to our hearts. We do serve a great number of children with special needs. So I'm just really excited to be here. I hope to offer, and share what Head Start is doing and what's been successful, or, what have been our lessons learned. I heard someone earlier talk about family engagement. Really excited to see that being a big piece of this work, because Head Start, of course I have a biased opinion, but Head Start has a really great approach to family engagement. So hope to bring that in, and then also to take what this work is doing and bring it out to Head Start partners, and again, try to encourage some of that alignment. So nice to see you all, and thanks for having me.
Thanks, Renee. Is there anyone else on the line that I haven't called on yet? That's a pretty amazing roundtable. Thank you. I will finish up. I'm Beth Trzanski. I'm the Deputy Director with Building Bright Futures. Public engagement and decision-making and creating systems that work is a passion of mine. And so it's thrilling to have all of you around this table to really lean in, even if there's difficult conversations, but to really improve how we're serving kids and families. So thanks for being here. Morgan?
All right. I'm thrilled to see all of you here. And I also recognize that I get really excited to talk with you all about the charge and the work and data, that I forget to introduce myself. So I am Morgan Crossman. I'm the Executive Director at Building Bright Futures. In my past life, I am a PhD trained researcher. So you hear me talk in every meeting about how important data is in informing policy, service provision, and all of our work. And I think that my role in this team is to create space for leaders to come together, to strategize, have really difficult conversations about how to move the work forward, and to keep us moving towards these outcomes that we are all articulating over the course of many years, right? So as you're looking at Vermont's Early Childhood Action Plan, the VCAP, in this most recent iteration, what's really exciting is that we have outcome measures that we're working towards. And now we need to monitor them, right? Where are we seeing improvements? Where aren't we? What are the gaps, and how does this team develop strategies across the system of services to really improve those outcomes for children and families? And how does this group lead the rest of the state and other leaders at the other layers of our infrastructure, the other groups that are monitoring other components of Vermont's Early Childhood Action Plan? So I'm really excited to have you all here. And now I want to transition to talking a little bit about the Act Early COVID-19 Response Grant. I'm going to have Lauren lead this section.
Great, thank you. So we've been talking about some big ideas, and one of the things that this team will be focused on in kind of the upcoming year is the Act Early COVID-19 Response Grant that was received by BBF and co-led by Help Me Grow Vermont and Janet as the state's Act Early ambassador, and the Science Act Early ambassador. So we do kind of have a specific charge in addition to all these things that we've been talking about in the first year. The grant runs September to September, so it's quick and it's very focused. Fortunately, it's very specific, but we see it as a key piece to the larger work that we're doing. And I was just in a call with someone recently who said it's such a score when you get a grant for something that you're already doing. And we feel like we really scored with this grant because it was work that we were trying to get off the ground right before COVID. And now we're able to really accelerate and have the resources to make it happen. So I'm going to share a little bit about what the priorities of that grant are. It was So as you can see on the slide, it was from the University Centers on Disabilities and the CDC, and it's really promoting resiliency among families during the COVID-19 response, but certainly a strong emphasis, of course, on sustainability and beyond COVID. Next slide, please. So we have some, priorities and things that we'll be focusing on as part of this grant, and that we will look to you all to help us, as Morgan was mentioning, to monitor the progress in these areas. The grant is really focused on the 4 steps of early identification, and that is the language that the CDC uses and Learn the Signs Act Early uses. It's really to improve early identification of developmental delays and disabilities. The first step is through parent engaged monitoring. So that is where we see a beautiful opportunity for, BBF and the parent leadership role in terms of how are we ensuring that parents are able to focus on their most important role as their children's expert in their developmental trajectory. And so there's a piece around that. Definitely looking at improving screening of both general development, social conditions of health, so across those domains, as well as screening for autism. So we'll be looking at, again, who's doing these activities already. Screening, you'll have heard me say this, I'm a broken record. Screening is such a unique priority in that it's shared across so many sectors. And so it is a benefit to have multiple folks really focused on this. But we want to ensure that we all know the right hand knows what the left hand is doing so that we can be better coordinated and more efficient, and certainly, remove any duplication or improve the experiences of the families in those situations. We want to ensure that we're building resiliency, that we're focused on family wellness, so improving children and families' physical and mental health, again, through that integrated and accessible system and an equitable system. We know that we have lots of room for improvement there, so that's really exciting to dive into. And certainly building connection between the child developmental health with social conditions of health. So as Morgan was saying in her introduction, prioritizing families' human needs, as we're calling them, basic needs, in terms of those are really, the child's context is really driving how their developmental trajectory is unfolding. And we know that to be more important now than ever. And we certainly want to reduce, any gaps and barriers that we know have been illuminated and highlighted and even, exemplified through the COVID pandemic that have existed, including accessing basic needs. So that's something that we'll be looking at. And because so many of you, and Morgan, I hope that I have an idea, so I'm going to go rogue here. Because so many of you have experience with developmental monitoring and screening, as we saw with the raising of hands earlier, I would love if anyone could think of a story that really illustrates the impact of screening, early identification, even parent engaged developmental monitoring, that they would like to share a success story. We certainly have some on cue, but I would love to hear from a few of you. And feel free to just pop off mute. I think we're a small enough group that we could just jump in. I know
so Lauren, I will say in my role, I don't do screening, so I'm actually going to share a personal success story and hope that that's okay. So I had an amazing pediatrician. My son is closer to 17 now, so it tells you that he's not little anymore. So this was way back, but an amazing pediatrician who really believed in screening and developmental screening and always walked through the steps. And he identified early on a speech delay and immediately referred us for services. And so by the time he was entering preschool, we didn't need them anymore. And I feel like it was such a proactive thing. And as a fairly new mom, like, it was not on my radar, I have to be honest, to that degree. And I think it was done in such a very factual, non-judgmental, and supportive way. And then we had this amazing speech therapist that we worked with for about a year. And I just feel like those are the pieces, like as professionals, it's so nice to hear, but as a mom who experienced that on a level that was so respectful and partnered with me, it just definitely, for me, became something that I deeply believe in and know of the positive outcomes it can have and what a difference it makes.
Thank you, Cheryl. That's a perfect example. And thank you for sharing that personal story and the fact that, you know, I think you highlighted kind of a universal truth among parenting, which is like, we don't know what we don't know, right? And then you layer on the stresses of anything else that might be going on, and having that one key person who can kind of guide you through that process can be so critical and, change outcomes, right? Anyone else want to share a story or an anecdote?
I can share the classic. If you go to the Let's Grow Kids website and go to some of our blog posts, you'll find one by Chris Nelson, who's a community and program support specialist up in the Northeast Kingdom. She's also the owner of a family childcare home, amongst other things. Chris wears about 1 million hats. Very active childcare badass, if we want to bounce off Morgan there. So she had an experience in her program where she had a new toddler in the program and was concerned about language, and that this child was at a stage where they should have had a little more language. They didn't. But the story is that the developmental screening opened the conversation between her and the mother. And it led them to sit down and really be like, okay, what sounds and words are you hearing at home? What are we hearing in care? They did the screen. It was just this, beautiful light bulbs going off when a child care provider and a parent worked together, and then we're able to refer the child and make some progress. The full story is on our website if you're interested.
Thank you, Tanya. So I think, in the, just to kind of keep us moving forward, because I think we could share a lot more. And I know that there's so many, great examples of how that one listening ear, that one open-ended question, that one connection, that one relationship, right? That can make such a big difference in family stress level, in identification, and then how quickly children are given the supports that they need to thrive. So next slide, please. We're going to talk a little bit next about some of the asks or some of the tasks that we have as a result of this grant. So the first step was to develop a state team, which, transparently really allowed us to kind of bring this group together under this grant and to be thinking about this kind of interdisciplinary cross-sector team to monitor this work and to move this work forward. We also had to complete a state level needs assessment, which Morgan and Beth and I were kind of debriefing earlier. It's not so much a needs assessment as it is kind of a survey or a check-in specifically around the Learn the Signs Act early materials and those 4 steps of early identification. Not surprising, very related to the grant. But I think when we hear as systems people and leaders and we hear needs assessment, I think we have a broader definition. So I just wanted to acknowledge that because many of you have received that partner survey. So there was a version that went out to key stakeholders that we were requesting that you share kind of how you're engaging in parents engaged developmental monitoring using the Learn the Signs Act early materials, which are those CDC branded materials, which I know so many of you are familiar with, and how you're engaging in screening, what are barriers, what are gaps, what are some emerging needs as a result of COVID. And so we are really eager to kind of collate all of your responses. And certainly as we're completing our kind of leadership the team lead needs assessment version, which is kind of that high level across systems, check in on how we're doing in those 4 buckets of early identification. Hope to be using your feedback on your partner surveys to inform that larger survey. So we had a very open conversation with the AUCD and CDC TA recently about how we really want to make sure that we're capturing all of that. And so with that, if there's a way, if you have not done that survey yet, when you complete it, if you wouldn't mind sharing a copy of that with Morgan or one of the leads, myself or Janet or Beth, that would be super helpful, because we do want to really make sure that this needs assessment, obviously will be helpful for the feds as they're looking across the grantees, but we want to make sure that it's really representative of the work that we're all doing. And we know that we don't know everything that's happening, all the good work that's going on.
Lauren, can I ask a quick question? Sorry,
Yeah.
it's Cynthia.
Yeah.
When I clicked on the link that was sent, it actually brought me to somebody else's completed survey. So I'm just wondering, can you reshare the link to that survey? Because I was not able to complete it. Thank you.
Yes. Has that happened to anyone else? Oh, Charlotte's saying yes, me too. This is the first we've heard of it. I'm so glad that we're talking about this.
So we'll reach out to AUCD because they'll have to resend the link. But thank you for letting us know.
Thank you, Dora. Next slide, please. Great. And so as some of the additional work that will be happening through this COVID-19 response grant was to develop or identify, develop, and implement, and then certainly evaluate a plan to address the needs and the barriers related to those 4 steps of early identification. And all this, right, is to improve resiliency, to improve family wellness. And we felt really proud that we had such a beautiful definition of resiliency to bring to the national table as we're thinking about the ways in which we want to do this in Vermont. And they also provided a definition. I don't think it's as good as ours, but really happy to see that from a public health perspective, that we're really focused on health, prevention and health promotion around early identification. And certainly this grant is very focused on utilizing, as I mentioned, the Learn the Signs Act Early tools and any sort of resiliency promotion materials. We have a very strong focus on engaging parents in leadership roles, and certainly that will be done in a variety of ways, and we will look to you all as leaders and experts in family engagement. But certainly, what do families need, I think, is a pressing question as we're thinking about how do we improve the work that we're already doing around developmental monitoring and screening. And finally, and I think, most importantly right now, is connecting families and communities to, concrete supports and services, right? So this all feels very aligned with our commitment as a state to strengthening families and ensuring that families have the protective and promotive factors to be resilient through a pandemic and beyond. So there's a strong focus on ensuring that the providers who are helping to usher families through these complicated systems, especially human service systems for families who might not have had to access those human service systems before, know where to go. And we're really focused on, ensuring that folks are aware that Help Me Grow has a resource hub that can help to get families to a variety of places and what they need in their community. We're also looking for that really strong feedback from the BVF regional councils, which again, work that is already happening, but we really want to strengthen those communication paths so that we know what families need. Things are changing so quickly, and I think it can be really easy for us to assume what might help, but we know that every community is different, and we want to make sure that we are developing our strategies as part of this grant to meet the actual needs of the children and families in our state. So certainly we're hoping that the Universal Developmental Screening Registry gets utilized even more, as that is the vehicle to communicate developmental screening results across sectors. As I mentioned earlier, developmental screening is unique in that we have so many shared stakeholders who are really committed to this effort. And so the registry is the place and is the way in which those developmental screening results can be shared to improve coordination, to ensure that pediatricians are aware when a screening is done in a different setting so that they can use that information in their well-child visit with families, and to ensure that earlier identification, of course. And as always, we're thinking about those longer term outcomes and knowing that that will ultimately improve kindergarten readiness for our young kiddos. We certainly want to improve the capacity. So we want the providers who are supporting families across early childhood sectors to have the confidence and the skills to really engage in developmental monitoring, screening, and that linkage to supports as best as they can, and with some really, stellar materials and those resources that they need to do their job well. So we do have a training component as part of this grant, as Tanya mentioned, which is really exciting, and we'll be looking to early care and education providers to improve developmental screening using the ASQ online system. Certainly there has been a need for more telehealth solutions through COVID, and we're really fortunate that the Help Me Grow system is hosting that ASQ online system for providers to virtually be able to offer screening, as well as to have parents more engaged in the screening, where they can receive a specific link on their own personal device to complete the screening in the comfort of their home, and take as much time with that screening as they might need. So we know that that's going to improve the quality of the screenings that are done by families, in getting that really important perspective of the families as their children's experts. And we're also going to be supporting CIS teams and getting on board with the ASQ online system as part of this project. Again, connecting the sectors. We know as much that, obviously CIS is doing really important work in this realm, right? And so we want to make sure that that work is connected and coordinated. And then we have a really exciting, I'm really excited, food insecurity project that we are partnering with Let's Grow Kids and Hunger Free Vermont to support early care and education providers around looking at that broader social conditions of health for families and how they can support having conversations around what families might need in terms of food security, knowing how astronomically that percentage of families who are food insecure has jumped as a result of COVID, and we suspect will continue to grow. And certainly knowing that early care and education providers play such an important role in terms of family relationships and connection, and having eyes on families in times where we might not have eyes on families in traditional other early childhood sectors right now. And certainly as we are gathering our information from the needs assessment, that you all are going to help inform this process. So we really looked, as I mentioned, to you to let us know in terms of what activities are happening and where you see opportunities, where you see gaps, and we will be able to, we have been assured that our work plan is a living document so that we can update that based on our specific state needs. Next slide, and I think that, so I'll bounce it back to Morgan.
Thank you. So before we do closing reflections, I want to, bring us back into the virtual room together. And I hope what you heard in hearing, Lauren talk about this grant is that Vermont already has most of those things in place in terms of the model, right? So the reason we're all in this virtual room is because we gathered the experts and brought them together to form the team, right? Then we do a needs assessment. We just completed the early childhood needs assessment, the Head Start needs assessment, the MCH needs assessment in the state of Vermont. We are needs assessment out, right? We're done. Instead, this one is focused on early identification and Learn the Signs Act early materials, but again, following the same process. Bring the experts together, do a needs assessment so that you're using data to inform the next step, which is, okay, what are the gaps? What are the strategies and the objectives? And then how do you move that work forward and monitor it? Well, we just updated Vermont's early childhood action plan. So we have the vehicle to build in strategies. That is also a living document. So when we say, oh, we're finalizing this plan, it's relevant for that day, we vote on it, and that's a beautiful thing. And how is the political system changing what we need to do for strategies? How is the work that you are all doing on the ground informing the strategies? How are we learning from our current practices and using data to shift strategies where we need to? So again, very exciting that we got a grant to do what we were already doing in the progression of identify experts, do the needs assessment, and then develop strategies and implement it and make sure that we are all using Vermont's Early Childhood Action Plan to be integrating those strategies. So I want to pause talking at you all and say, what are you thinking about? What questions do you have about the work of this group? What's exciting to you?
I'll start us off. I'm thinking that one good thing about our response, our collective response, at least in Vermont, to the COVID pandemic, is that there is increasing comfort with the use of virtual technologies among our early childhood providers. And I can only really speak to, it's my sense from, for example, the Strengthening Families grantees with whom I work, that they are just more comfortable and more open to things. And I hope that that will, for example, translate to the use of the registry. I'll stop there.
Can I jump on to what Amy said? I think that in addition to the comfortability, which I hate saying because then technology always screws up on my end, I think that it also allows us to get a broader view of the state rather than being either Burlington area centralized or our own area of the state centralized. So that's one of the pieces that I really like about this work group. And that's one of the pieces that I'm really excited about as we bring the work forward.
I love the cross-sector view here. I love the broad view across mental health, across education, across human services and early education. I think that's maybe what most excites me, or is one of the things that excite.
I would echo what Bev just said. And I feel like because we're in a virtual world, we are probably more likely to be getting this cross-sector from so many areas of practice and around the state. So I love that, because I think the more we talk and coordinate, just the better able we are to make sure that families have what they need.
Yeah, I'll jump in. I love that, to jump off Cheryl's, I love that we're at this point, right, where we know what the outcome can be, right? But now we're like in this really beautiful place of connection and partnership, right, to make things happen. The other thing I have to say that I love is the big emphasis on training and support that's weaved into this, because what we all know is that being trained and supported in this is one of the most important things that we can do for EC providers. And, we're really hoping that that becomes something that's very well integrated and built into the system of the future.
That's great. Any other questions about the role of this team, the grant itself? The only other thing I want to mention about this grant is that it's really about AUCD and CDC providing TA to support Vermont. So the other thing that we'd like this group to be able to help with is saying, here's what we need from national partners. It could be, here's what we'd like to disseminate to the rest of the country, right? Here's some incredible work that we're doing and we want to elevate it. And what do we want to learn or know from other states about what's working and what's not, and bringing it back to our group and disseminating it across sectors. But as we move forward with the specific grant components, we'll have a team folder so folks can see any information that is coming from the federal partners and national partners, so that you can see their definition of resilience, anything that they're asking us to be thinking about and disseminating. So that's, we're excited about the grant, but I think even more so, we are excited about this team coming together to be this accountability infrastructure for Goal 1 of Vermont's Early Childhood Action Plan, and really serving in that leadership role across the state. So, you know, what's interesting is we haven't necessarily named it, but this is the newest VCAP committee, right? So you're monitoring Goal 1, and we want you to be at this table, but we also want you to see yourselves as a part of, not necessarily, you know, not just BBF, but that this early childhood network infrastructure that BBF is trying to support. So we want you to be at the State Advisory Council meetings and engaged in other things, recognizing that there's very limited capacity. But what I don't want folks to see is that the State Advisory Council is over here doing work and making decisions and setting priorities and making recommendations. That work is informed by this group. So please come to those meetings, listen in, participate. We're really trying, our team at Building Bright Futures is really trying to create new spaces and new engagement strategies to make sure that people understand the role of this broader infrastructure and how they can be engaged. So if you have questions about that, please let us know, but we'd love to see your faces at those virtual tables as well.
Morgan, it strikes me that this also bears saying that I think this group picks up some of the threads of the Aligning Early Childhood with Medicaid work group that that gave thought to some of this work of the importance of developmental and social determinant of health screening across sectors that support children and young children and families, including primary care, in the home, and in the early childhood setting. And we really felt like the early childhood setting was a place where we weren't doing as much of that work, and where we were trying to model some of what we were trying to do off of what was happening in those other sectors to create that alignment and consistency. And I just think for those on this call that might not know of that work, we should at least just maybe highlight that for everybody, and to recognize that some of the people around this table were part of that thinking. And I think that this, and that we were excited about what we were able to do to get a seed of that started with the food insecurity screening in early childhood centers and the pilot that's happening right now. And so I think that this grant gives us the opportunity to build on and continue some of that exciting work. And I just thought I'd highlight that.
Thank you, Bev. That's great. That's really important. And I love that this group can be a sustainable mechanism for that aligning early childhood and Medicaid work, because it really was critical and exciting, and it's the right opportunity. So I'm seeing that folks need to hop off, and I would actually like to end this meeting early so that you do have 5 minutes to get tea and use the restroom and do whatever you need to do to prep for your meeting. So what I want to do really quickly is say, we will reach out to the federal partners to get you the right survey link. So if you're having trouble with that, we understand. We'll get it out to you as soon as possible. Please respond by the 30th and capture it and send it to myself, Dora, or Lauren, so that we can integrate it into the full state one. The other thing I want this group to really take a look at, because we're so excited about this work, is the update to Vermont's Early Childhood Action Plan. We're thrilled about this. We want you to read it. We want you to see yourselves in it and use it. So please review that. Before the next meeting, we'd like you all to look around this virtual table and say, what other badass leaders aren't at this table that need to be? So who isn't here that should be, that can help us in thinking about Goal 1? So you may read Goal 1 of this new strategic plan and say, oh, this partner isn't at the table. Please reach out and let us know that. And the last thing I want to say is we're thrilled to have you at the table. We want you at other tables, recognizing there's limited capacity. We're also standing up in the background, again, improving our practices at Building Bright Futures, Vermont's Early Childhood Resource Data and Policy Center. So as you are all working in your silo to identify data and put it out to the field, let us help you get that information out to the field, and we will integrate it through this data center. We had an exciting chat bar exercise, but again, I want you to take the next 5 minutes, and instead of doing that, take 5 minutes for yourself. And if anyone does have feedback on what worked or what we could think about doing differently in future meetings, please let us know via email. But we're really, really happy to have you. So thank you, everyone.
Thank you, Morgan.
Enjoy the rest of your day.
Great meeting. Thank you.
Thanks, everyone.
Bye.
Thanks.
Bye, everyone.